And that's everybody's cue to like act weird and not say anything. All right. Yeah, we're letting everybody in now. Awesome. Welcome, everybody. Thank you for patiently waiting in the waiting room. I'm Michael Cowen with Waking to Sleep. I'm going to be your host tonight, along with Joanna Booher, who's our co-host. You were on last month's webinar with Dr. Suzanne Tai. You know that this is the Wake Up Call webinar series. Our goal is to bring you guys awesome people with great stories and lots of nuggets. So Dr. Jeff Haddad is our guest tonight. We're going to hang out tonight. As you guys know, I'm sure this is no one's first webinar, but just in case it is, you came here to ask questions, learn about Dr. Haddad and his practices, and probably get some CEs. You'll get one CE if you hang out for the evening. If you don't, you won't. You got to hang out for the hour. You know how this goes. We'll have the CE link at the end in the chat. You got to stay to the end, fill out a quick survey, all of that stuff. If you are here tonight and attending, you will also get an email tomorrow. I promise it will be in your inbox. If it's not, check your spam. We have sent it officially. You will get the email link as well, etc. All right. Without further ado, we are here to hang out with Dr. Haddad. We want to talk about these crazy TMJ patients, because they're all crazy, right?
They are all crazy. This is true.
Well, we've all got our version of crazy, right?
Yeah.
But hey, before we get into that, let's get to know each other a little bit. Dr. Haddad, it feels like we've been friends for a while.
Yeah.
But I'd love to have you share with the audience, just give us a little bit of your background, who you are, where you practice, and what's unique about those practices.
Perfect. Well, Michael, thank you for having me. I know it's honestly, we haven't known each other that long, but we definitely hit it off right out of the gate. Very similar philosophies with doctors and patients and all that, right? So, my story, I don't believe in luck. I believe that the harder you work, the luckier you get. However, I have had some luck in my time, and one of which was I kind of had the unicorn job, if you will. I had three offers on the table, and I met this guy kind of last minute, and he wasn't offering me a job. His name was Kurt Doolin. He said, "We got to hang out. We got to golf together. You got to meet my family." And I said, "Well, can we do that today? Because I've got other people I got to, tell them yes or no on the job." Long story short, he said, "If you're going to come work with me," I just got introduced to what's called neuromuscular dentistry. And I've had this conversation with so many dentists because I teach across the country. Um, I've never met one person that said that they knew what occlusion was or how it worked coming out of dental school, right? And neither did I. I had no clue. But this made a lot of sense to me. Well, with neuromuscular dentistry, it's based on muscles. It uses technology that measures the facial muscles, headache muscles, jaw muscles. And it really is, I wouldn't say it's meant to treat TMJ disorders, but it's kind of a marriage there. It's about occlusion, but it's about balance occlusion that also keeps the muscles calm, which everybody on this webinar, I'm sure, knows that occlusion is a big factor in TMJ disorders. Well, it's also a big factor in treating sleep breathing disorders. So for me, right out of the gate, I was treating TMJ patients, and yes, there are some tough ones out there, but I will tell you, they're not crazy. Some may be attached to their symptoms and pain. It's maybe their identity, but most are just being treated by doctors unpredictably and inconsistently and then unsuccessfully, so they get frustrated, right? And then in 2004, which was only about 3 years out of school for me, I know I look like I'm only 30, but I am a little older, just so you know, Michael. I took my first sleep apnea course, and it was from Kent Smith, who
Yep.
everybody knows. And right away I was like, all right, this there's a good combination here. Maybe even a little overlap, maybe.
Hmm.
And then I started treating more and more of these patients. And not only did I realize that there was an overlap, at this point in my career, which we can talk about, I don't, every TMJ patient that comes to me is recommended a sleep study because as far as the articles and studies go, about 75 to 80% of TMJ patients have a sleep breathing disorder. Okay, whether it be snoring, whether it be sleep apnea, whether it be UARS, and my thing, and you and I, this is why you and I are hitting it off here. It's like we have so many doctors who are treating sleep patients, and it's very fulfilling. It's life changing, and I love it. If you want to treat more,
Yeah.
then you need to embrace TMJ disorders, which I know is a little maybe scary for some people, but I'm hoping to inspire people today because I treat so much more sleep apnea patients because
Yep.
people find me for TMD, right?
Yep.
And vice versa. People find me for sleep, and I think the latest stat is about 52% of people with sleep breathing disorders have either TMD symptoms
Mhm.
or are prone to them.
Right.
They're the same patients. So, I want to encourage doctors to consider one or the other or both because it will build your practice.
Yep. Amen. And I want to have a point of clarity here because I know some of the folks on here, we are good friends and we've had plenty of these discussions. If you're treating sleep only, this does not mean that treating their sleep apnea is causing 52% of these people to have TMD
No,
symptoms.
no.
It's a similar and adjacent population. If you're
Yeah,
not treating both, then we're missing the adjacent population that we can treat. That's kind of the take home here. Um,
absolutely. Well, and you want to
well,
educate your patients, right? I mean, every patient that comes to me, whether it's a TMD patient or sleep apnea patient, you educate them.
yeah,
You let them know the signs and symptoms. If you are educated on both, then you're going to tell your patient, well, listen, you have a lot of TMD symptoms here. We're going to treat your sleep apnea, but I need you to understand,
yeah,
even our precise, appliances we're going to make for you, there's a chance it could aggravate your symptoms.
yeah,
I need you to be aware of that. But if you also treat TMD, you can confidently say, well, listen, if it does happen, we can take care of you as far as that goes as well.
yeah, absolutely. Speaking of education, we're almost missing this, and I want to go back just a tad. You
Mhm.
had an undergrad degree in psychology,
I
which,
did.
it's kind of like a generic degree sometimes, like, oh, psychology, sociology, or business, until it
Right.
gets applied.
Yeah.
Now that you're running three practices, you're doing what a lot of people dream about doing
Mhm.
in the day-to-day doing. Is there anything from that degree or things that you've pulled from that psychology background that actually helps in your dialogue, your conversations with patients today?
So I chose psychology because I was planning on going into medicine, and I started volunteering at the U of M hospital. Go Blue! And it takes a lot to put me in a bad mood, Michael. You know that.
Yeah.
And I mean, I give physicians all the credit in the world. I mean, it is a very depressing atmosphere. People die, right? So I decided that I need to figure something else out. Well, my best friend in the world, his dad was a cardiologist. Hey, Jeff, how's pre-med going? It's not going great, Dr. Greenberg. I just don't think I can do it. And he says, well, what about dentistry? You ever hear that or think about that? And I said, no. And I kind of laughed it off. And he said, no, I've got a lot of great friends who love it, all that. So I said, all right, well, maybe I'll consider that. He said, well, what are you majoring in? I said, biology. He said, why? And I'm like, don't I have to? He's like, no. He's like, what's your favorite subject? And I said, psychology. I love it. He said, that's what you're majoring in. You're going to get all your sciences
Yep.
and it's all good. And it is a game changer. I use it every day. I have a lecture that's called The Psychology of a Dental Patient. And every single day, and I will tell you, whether it be TMD or sleep breathing disorders, you have got to be obviously compassionate,
Yep.
but you have to get in the head of these people because they are, let's just talk to the sleep doctors here. Think
Mhm.
about the patients who were only told CPAP could save them. And because they weren't one of the whatever 28% who can, they've been suffering, have been put on anti-anxiety medicine, antidepressants. They're being pretty much treated as crazy when all they needed was some restorative sleep, right?
Yep.
I use it every day. And you don't have to be a psychology major to have that background, but understanding what these people are feeling and what they're going through and what they have gone through will help you. I will use a word, sell more dentistry. Okay, I know that's a bad word, but it's not. We're all selling. The good news is we're doctors and we're selling something that is impactful to their life.
Yeah.
But you could be the most amazing clinician in the world. If you can't get people to say yes to your treatment, it's
Yeah.
wasted talent.
Yeah.
So you have to understand your patients, and we'll talk about this. I know, Michael, as you love this. My team does the majority of the heavy lifting for me because I empower them, I invest in them, I have educated them or gotten them educated, and they do the heavy lifting. They're the advocates for me, and then I can come in and just be a doctor and say, yes, I agree. Or
Yeah.
maybe I have to answer a couple questions, but it's not being put in a salesman role like unfortunately a lot of us are.
Yeah. Absolutely. Joe, go.
Oh
I see
yeah,
your face. You're
you're
on the
good.
team
You're
side here.
good. Okay, so
Joe, you
I
gotta, we'll just keep talking.
I
It's
just think
terrible.
you guys are doing such a great job over here. Um, so you've created your TMJ and your sleep approach. Like what makes those different and what problems are you trying to solve with like existing approaches?
So I trademark a couple of my approaches because I use this neuromuscular approach that I was taught for TMD. So it utilizes an FDA approved TENS machine. It's actually a dental TENS. And we've all heard of TENS machines for that physical therapists use, and it fatigues the muscles. Usually it's high frequency. This is an ultra low frequency dental TENS. It's put on the coronoid notch here, where we're actually stimulating the nerve. This is a 9-volt battery, though. Okay. It's like back in seventh grade when we made the little frog leg kick, right? Instead of fatiguing the
Yeah.
muscle, we are bringing oxygen,
Mm.
blood flow, and bringing the muscles to the proper resting length. And then I capture that position with a bite registration, not only for my TMJ appliances, but I also do it for my sleep appliances. Why do I do that? Well, a couple of years into us embracing sleep, my partner at the time, Dr. Doolin, and this always happens, he decided he treated his cousin with a sleep appliance. It was a Somnomed back in the day, Somnodent, and great appliance. And we were just using George Gage like we were taught.
Yeah.
Well, next thing you know, Jean was thrown into a full-on TMJ spiral. Never had symptoms. She's having migraines, jaw pain, and if anybody on this is listening, you've been treated sleep enough, I promise you've had that. It happens. Well, we decided, like, all right, well, we measure the muscles for TMD patients.
Mhm.
Why don't we measure the muscles for our sleep appliances? It's a different position. Obviously, we have to open them up a little bit more. It's more about the airway. But if I make an appliance in a comfortable muscular position, and I've proven it so many times because it's kind of cool. I have patients who find me or are referred to me if they have a TMJ issue, right?
Yeah.
I have doctors in the area, and they're great doctors that use same appliance as me. I'm a big ProSomnus guy. Um, and I have treated, I can think of probably half a dozen that were using the same appliance as me,
Mhm.
but they were in complete jaw pain, headaches, facial pain. We found a different position with measured objective data of what we do is we measure the anterior temporalis, masseters, digastrics, and sternocleidomastoids.
Yep.
And in real time, I can see with jaw tracking where the jaw is most comfortable based on muscles, and I capture that position. And those same patients that were in the same appliance as me, but in a different position, were then comfortable and pain-free. So that's what drives me, Joanna. I'm not saying that you have to treat TMD and you do not have to find jaw positions like I do. But I am the TMJ guy in the area. So
Yeah.
I got to make sure that I'm not causing it.
Yeah.
Yep.
And I also have to make sure that I'm treating people consistently. So that's what drove me.
Yeah. Hey, real fast, I'm going to call it timeout because this is amazing. And I totally forgot to do one of my jobs in the beginning. So for everybody that's on the webinar, if you have questions, we are here to answer your questions, not just pepper Dr. Haddad with our questions.
Mhm.
Throw your questions in the Q&A, please. If you have any responses or any tech issues, please put those in the chat. But you guys have the Q&A button. You can submit your questions. We would love to hear from you. Please stick yours in there, and then we'll keep going here.
Perfect.
Jeff, you just said something to me that is crucial. You can use the same appliance and start it in a different position neuromuscularly for patients that are going into that TMJ spiral.
Mm-hmm.
You said, look, you don't have to treat TMD in order to start with a new position like this. So there's obviously these steps that you've gone along in your journey with this. I want to hear more about that in a second, but I want to pause on the team side. This just sounds really long in your appointment. You're measuring all these extra muscles, you're
Oh,
doing a
yeah.
TENS unit. Could you, just as a snapshot, give us what does this total appointment time look like? Just the bullet points of what's covered. And is your team doing most of this? Are you doing, like, what's your time commitment here?
Oh, I love that. Actually, Joe and I were kind of exchanging emails a little bit on some of this, and she, without me even saying it, she kind of alluded to continuing education and how, I mean, I'm a nerd. I've got probably over 2,000 hours of education, but a lot of people don't apply it, right? I am all about practical. I mean, I sift through things. I can see a lecture and I'm like, yep, that's great. Nope, that's a waste of my time, or that's going to be inefficient in my practice. So to answer your question, Michael, yes, a George gauge is very fast and we're in and out. Okay.
Mhm.
So the extra time that's not involving me at all, we usually tend somebody for about 45 minutes.
Okay.
So unless you only have one dental chair, they can be in another dental chair. And
Mhm.
and we'll get to this, but I mean, I have three practices. My general practice, I do this as well. Well, listen, when somebody's sitting there tensing for say an hour, I'm not sitting around, looking at emails. I'm producing.
Yep.
Okay. Always gotta be, I mean, we are dentists, we have to be productive. We just have to be. So my total time for a sleep appliance is 5 minutes max. Maybe it's 10 because I like to hang out with people a little bit and we talk a little bit. All right. Now, I see them on the delivery. And again, that's where the relationship is built. But when I shoot a bite or get the bite registration, I say shoot a bite. It's 5 minutes of my time, maybe 10 minutes. My team not only, and by the way, okay, here's a little sidebar. I haven't even met the patient yet, and I walk in and I get my jaw position.
Mm.
Now, this is the beauty of what I think I do, right? I'm very practical. My time, all dentist time, is so precious, but most dentists don't think that way. They could have a patient in the chair for 3 hours and have the most beautiful crown prep you've ever seen, okay? And they're gonna go bankrupt, okay? Because I can do the same thing in a third of the time. And if you're doing something that's clinically significant, that's fair.
Yeah.
But what could you really be doing to one tooth for 3 hours?
Yeah.
And unfortunately, sleep dentists get into that as well because they want to do the full consult and they want to talk about things. They want to teach the patient to pretty much be a dentist. And I'm not knocking on dentists, but I just teach enough of them. They're just not understanding that that person, if I was in the chair, I don't care about how you're going to find my airway position. I don't care if, I'm going to get to the better stages of sleep and you want to talk to me about them. I care about this. How are you going to affect my life? How are you going to give me more energy? How are you going to get me to stop snoring so that my wife wants me to stay in bed with her?
Yep.
And how much?
Yep.
Like, and I know I'm different than a lot of people, but know who you're talking to. You don't have to teach these patients how to be dentists. And in my opinion, most dentists just take so much time talking when in reality, their team
Mhm.
not only will do a better job, but are advocates for you. They take you out of the salesman role and you can just come in and be a doctor. That's what we all want, but most dentists don't allow that because we're all micromanagers and we think that we can do everything better than everybody else. And I'm telling you guys, I'm a really good talker and I'm really good at getting people to say yes. I am not as good as my team.
Mm.
I'm not. So by the time they get to me, not only have they already been vetted, they've already paid. I walk in, I get to just be myself, introduce myself, get the jaw position, and then we build a relationship after that.
Yep.
Because you guys are trying to build a relationship and sell them, and they haven't even said yes to your treatment yet.
Yeah.
So how does that work for a business model? It affects it pretty pretty significantly.
All right, I'm going to go out on a limb and say that if anybody tries to give you specifically more energy, that's illegal in most states.
It's scary.
I
know.
think I
I'm
need
sorry.
some of that.
It's
Holy
like
cow.
I've been very
8:20.
blessed with this.
Yeah.
Yeah, I'm writing this out until God takes it away from me. But yes,
Yeah.
I'm high energy guy.
I have a
Yeah.
question.
Go ahead, Joe.
Kind of on like the clinical side, because
Okay.
a lot of our guests are in the dental side where we're the clinical
Of
brain.
course.
So if you are doing this muscle mapping per se, and you're getting that precision approach and the
Mhm.
patient's comfortable,
Mhm.
what about when you titrate the device and it puts them out of that comfort zone and
Yeah,
it does stress? Like, do you recommend exercises with that? How do you compensate their relaxation, great position, but then also we have to open their airway?
it's a great question. So, um, please understand that I treat everybody like the princess and the pea. That somebody's got the perfect little sweet spot, but that's not the reality.
Right.
We all have a zone. If we didn't, then our sleep dentists would not have the success they have, right?
Yeah.
So, me getting them into this perfect spot, quote unquote, it's the perfect starting position. And there's a zone. Now, don't get me wrong, there are the princes of the peas that we have all dealt with, and so do I, that yeah, you get them out of that comfort zone, it could be a problem. But with this approach, it doesn't happen very often. And as I titrate like 1 millimeter at a time. I'm very slow. Um, my the way I was taught is that this is a physiologic position. With the George gauge, we start them there. The way I was taught, and a lot of people are taught, you bring them back in like 2 days, 3 days, you're moving forward. 3 days later, moving forward. They're not storing, moving forward. It is too fast.
Mm.
And we're not robots, we're not mechanics. And this is not just forward. The lower jaw moves like a plane. Okay? Open, close, lateral, pitch, yaw, roll, right? So this is not just moving forward until it stops. Now you can do that, but in my opinion, you're asking for trouble. So just so you know, Joe, so my protocol is this. I give them the appliance. I start them in the neutrals. I use a ProSomnus Evo. So they're in the U0, L0. In my position I found that was measured and muscularly calm. We don't move anything for 30 days. And people are like, oh, so you bring them back in 30 days? No, I don't. They call in 30 days. Because why do I want to waste chair time talking when my team can tell them very easily over the phone, just swap out the two lowers and you're
Yeah.
fine.
Mm-hmm.
But dentists want to just see people and all stuff, but you guys don't understand, or if you do, I'm going to remind you, time is money, chair time is money. So let's let our team do the heavy lifting. So then at 30 days, if they are not snoring, feeling amazing, I leave it alone. I don't order a titration study though for another good month, even month and a half. The way I was taught is healing occurs. If you stop snoring or just lessen it,
Mm-hmm.
then we've got less vibrations. Inflammation of the soft palate and the throat are going to shrink away on their own, and their sleep and airway will get better without me mechanically jamming them forward. So I'm very patient. I educate my patients on the front end. But Doc, I got to stop snoring. Listen, John, you've been snoring for 20 years, okay? Give me a month. Let's just take it easy here, right? So it doesn't happen that often, Joe, but if it does, first of all, I've educated them on the front end because I identify them as a TMJ patient or even an asymptomatic TMJ patient. I'm a big believer of giving reasons on the front end
Yep.
instead of excuses after,
Yeah.
right? So if it does happen and we've gotten to a point where it's causing some jaw issues or headaches, I can adjust my appliance to accommodate things. That's one of the first things. A
Right.
real good tip with the Evos or the ProSomnus is if they're hitting way too heavy in the front, even that out. You really want things more posterior and more even across. But if it gets into a situation where they are having real TMJ symptoms, I'm going to treat them because I've told them on the front end that this was a possibility and we treat them as necessary, you know?
Yeah.
So it's very predictable in my world just because I've been treating TMD patients for so long. But the starting point that I have, very rarely as we go forward do we get them out of their comfort zone. But if
Gotcha.
we do also, and this is a good thing for everybody, despite your approach, there are limitations with human beings. I
Yeah.
mean, we can only go so much as the body allows us. And so let's say they were a 25 AHI and you got them down to a 9 and you're like, we got to do better. I want it below 5. And we go to that next level, well, they're starting having issues.
Mhm.
That may be it.
Yep.
And I mean, as far as I know, I think 50% of AHI is still very acceptable. They can always do CPAP, but they usually don't want to. But there are limitations. So you have to don't let the patient dictate success when you're the doctor and you know that there are limitations on the body, right? I mean, we all want perfection. Believe me, I do. I always do. But chasing perfection, you're never going to be happy because it doesn't exist.
Yeah.
We need optimal. I like that word. Let's
Yeah.
optimize the situation best we can.
Yeah. I mean, Jeff, this is something that we teach all of our clients as they're trying to find this, the magic position.
Right.
We're looking for maximum medical improvement, MMI. That's
You
it.
got it.
The body always gets a vote. We're looking at AHI numbers. We're looking at the oxygen regeneration. I mean, red blood cells take 90 days to regenerate. So, and you're like, wait 30 days, see how you're doing. Wait another month, month and a half. I mean, we're pushing the 3 month line where when the apnea and the snoring is resolved, the red blood cells are starting to regenerate and heal and bind oxygen better based on that healed state. So, I mean, there's a lot of things that are going on in the background, but just looking at this, like you're doing this on purpose with intention for the bite, the position. I think one other thing, just to make sure I heard you right, in this titration process, when you are moving them forward within that range, once you get to that spot, you are getting data on them with the test. Either you're ordering it or the physician who
Absolutely.
referred is ordering out.
Yeah. Well, so the way I look at it is this. Money makes the world go round, right? And we know we have some patients who are very, very money driven. So I use sleeptest.com for the majority of my testing. I think it's just a great company. And they do a great job working with insurance, but it's still, there's money out of pocket. Maybe it's a couple $100, maybe 300 bucks, whatever that looks like. It's money. I don't want to waste my patient's money. B, I don't want to waste their time or mine. So if you prematurely order a titration study and your results come back and they're not that great, okay, well, what do we do it for, right? So for me, I want them not snoring or essentially not snoring and noticing a true difference in energy levels. Those are my two things. Once we've got that, I still wait about another month or so before I order the titration study. I want that healing to occur. I want the physiology to find its equilibrium, and I want the best chance of that test coming back awesome.
Yep.
Because if it does come back better or in the awesome arena, but it's still not under 5, at least I know that I've got them in a good spot. And now let's see if we can go a little further, right?
Yep.
And I don't want to waste the patient's time or money, and I don't want to waste my time or my money, right? So that's why I think a lot of dentists prematurely order titration studies. They prematurely advance the patient. I had a physician, sleep physician, great physician in the area, and he was surprised at my approach because with CPAP, they're just like, hey, does it work? This and this.
Mhm.
Well, it's a different thing. I mean, they're blowing air down a throat. It's different than an appliance that's allowing some healing to happen, right?
Mhm.
And so he was like, well, are there any studies that show that? I'm like, No, there's not. I'm sorry. This is more anecdotal, but that's what I found worked in our practices.
Yep. Yep. And I know, Joe, I know you're going to go to the Q&A section. I want to just add one more thing here before we do that. Jeff, we've also worked with a lot of practices on their titration protocols with incremental testing. Like you said, the money makes the world go round.
Right.
Start costing people more money. There's friction with that. So we've got a titration protocol down where you can use it's $50 through our service that
Perfect.
costs, it's $50 for a 30-day window. So,
Beautiful.
you can do unlimited testing for that. I mean, so there are approaches out there that we can keep that cost down. But to everybody else listening, please hear what Dr. Haddad said. You're always getting a final efficacy test on these patients in that ending position that's read by an MD, or you're referring out to make sure that gets read. That's the cover
Absolutely.
your butt.
It's
Please make
well,
sure you know
and
that.
again, it's objective data, right? Like
Yep.
that's why and I don't get any, anything for saying this. I mean, I lecture for Myotronics. That's the equipment I use. I don't get anything for saying that. I just believe in objective data, and most doctors do too, right? Like you're not going to get a heart surgery or have a heart, a procedure without say an EKG, right? And so
Right.
it's the same thing with sleep.
Yep.
The dentists out there are like, oh, they stopped snoring. They're done. No. I mean, 50% of people who have sleep apnea don't snore. So, yes, I mean, the biggest problem I have, and it's such a bummer, but it's in all our worlds, is getting the patient to do the titration study
Yeah.
because they're feeling great. They stop snoring. They're done. I mean, for those of you who don't think a titration study kind of final objective data is important. Not only is it good to make sure that your appliance is effective, but I will tell you the marketing that you get when you send a before and after sleep study to an ENT, to a primary care physician, to a sleep doctor, it's invaluable. They need to know that we are having success because they don't believe
Yep.
we are. The
Yep.
majority of physicians out there do not think our appliances work, which is sad because there's been studies over the last, God, at least decade or more that show that. But having that final titration study that shows success, if you just sit there and look at it and are happy with yourself, that's good. But please, that is gold. Get it out to everybody that'll look at it. That will result in more patients being referred to you because they will know that you're paying attention and that you're having success.
Yep.
I think there's a lot of dentists out there that any dentist can scan for an appliance, right? Any dentist can take a bite but this is what sets most dentists that are in this space apart is if they really have that provider outreach and those relationships and actually follow through and prove that these appliances, have that efficacy, they are working, our patients are treated, subjective, objective, all of that. So I am 100% believer in that provider communication, because most dentists, a lot of dentists out there don't have that. They'll just scan, make an appliance, and then that's it. And they don't even
Yep.
know how to titrate. We have so many patients that will come in and be like, my dentist never even showed me how to use this thing.
Yeah.
And I paid, 5 grand for it.
Right. Well, I think what you're saying, Joe, is it's so true, but also I think that dentists are missing opportunities. Um, like I just feel like there's too many opportunities in our profession. And if you want to do more of what I call life-changing dentistry, because that's what I do, I change people's lives. I get people out of pain. I get people restful sleep. I save marriages, and I rebuild people's mouths because they found me for TMJ. We got them out of pain, and their occlusion and dentistry and dentition is destroyed, and we rebuild them. And now they got $1 million smile and are living without pain. If you want to do more of that, let's just keep in the sleep arena, then you need to get the word out that you're doing this.
Yeah.
You've
Yep.
got to, and if you are not like me, which I'm glad you're not because it's a little scary thing. But I mean, I have team members, and listen, life is busy. I have 3 kids. I got 3 practices. I mean, I love my life. I can't do it all. Early on, I did it all. Okay. But if you are not, if you don't have a personality like me or that doesn't interest you, that's okay. Trust your team. Let your team get trained. I teach doctors across the country. I'm like, and I can right out of the gate. I'm like, listen, I know that you're a little bit more introverted than me, but here's the deal. Your assistant over there or your front office, she's amazing. Let her go. Let her take these titration studies. Let her take an example of the appliance that you use. Because most people think they're medieval torture devices.
Right.
Most physicians,
But
right? They do.
clarification, let her run with this. Don't let her go, right?
That's correct. Yeah.
Okay,
Sorry.
good.
Let her, yes, please do. Let her go and do things for you. Let her be your advocate.
Yeah.
And if you want to train her, great. If, I mean, God, Michael, I know you guys do it. I mean, let somebody help you because even me and my high energy, there's only so much time in the world, okay? And so, but I will tell you, Joe and I again over email, she was like, "Well, how did you kind of start networking?" It started with an ENT that my original partner was using that I was referring airway patients to, and the patients are coming back pretty much saying the guy's making fun of the fact that a dentist is referring to them. Why are you here? Well, my dentist like, why is your dentist sending you? I mean, like I couldn't think it sounded like any more insulting. I'm sending you patients because I'm paying attention and you're making me feel bad about it. Okay, well, then
Yeah.
you're not the right person for me. So I went out and started interviewing ENTs and just asked if they wanted to get lunch. Every one of them was like, wait, you treat TMJ patients? I don't even know what to do with these people. Wait, you treat sleep? That's amazing.
Yeah.
They don't know you're there unless you get your story out there,
Yeah.
right?
Yeah.
And I'm telling you, the ENTs, in my opinion, are the gold mine of all referrals, whether it be TMD or sleep. They pay attention. They get the majority of patients. I mean, think about how many ear symptoms are with TMD. Think about the fact that they're looking the airway. I can't say enough. So I've really gone over and beyond with getting out there with ENTs. I took Michael's advice. I He said I needed a full-time rep. I didn't really believe him, so I started with my daughter, who's 19. I made her internship this summer, and she's doing it 3 days a week, and it has been a game changer. Game changer. When she walks in and says, "Yeah, listen, I'm not sure if you have any TMJ or sleep patients. Wait, we have all kinds of them. You treat them." I mean, these doctors need you. And what's very cool is it's a mutually beneficial relationship because you're going to have your sleep apnea patients that need their airways or a deviated septum is taken care of,
Yep.
or your appliance is going to work.
Yep.
So it's a mutually beneficial thing that works out great for everybody, and the patients win in the end. So it's something I encourage all my doctors, but it takes some time.
Yeah.
But if you don't have the time or that type of personality, then have one of your team members do it. I mean, it'll be a game changer for your practice.
Yeah. Absolutely. Hey, I want to. I told everybody that we were here for their questions, and we've got to
Let's
make good on that.
do it.
So let me. There are some in the Q&A. Let me ask the first one. This is our TMD webinar after all. So some of the folks are redirecting us from the sleep stuff back to TMD.
Oh, perfect. I
On
was
this
trying to
one,
I was trying to redirect the other way. Perfect. Good.
yeah, no, it's okay. He says, this is from Nick, talking about sales. What's the best way to build the business side of TMD? We already started talking about that with ENTs, et cetera. He said, what specifically do you bill and how do you bill it? We're not asking for your fee schedule, to be clear,
Yeah.
but more of a, what are the, I'll clarify this question a little bit too. You have two completely different TMD practices. One is fee for service, one is insurance based.
Yep.
Could you give us just a bullet point list of here's the procedures that I do in the insurance based side
Mhm.
versus everything that you can do on the fee for service?
Yes. So I will warn you that when it comes to TMD, insurance is it's very difficult. It's very difficult. So the practice I started about 12 years ago, total fee for service, because I already was dealing with TMD and I knew it was very difficult. Okay. One of the practices, one of my competitors approached me when he wanted to start retiring, and I bought his practice, which is a full-on insurance-based practice. Now, we can talk money. It's not a big deal. They charge about $2,750 for an orthotic. The problem is in Michigan, which is where I'm at, if they are a Blue Cross patient, that goes down to $800. And even if your lab bill is 200 bucks, it is tough. Now, there's office visits and we make it work because there's enough other insurances that we don't have to do that. But I will warn you that that's a problem.
Yeah.
The reason that I don't do work with insurance in my TMD patients is because of that reason.
Hmm.
And I've been educated by many people, and Pristine Medical is one of them. Melissa Koger is someone we work with.
Hmm.
They don't even bill TMD because it's not even worth their time. So I would encourage you to weigh the pros and cons. Okay. There's some things that they do in that practice, injections, trigger point injections, those are covered. I mean, let's be honest, I hate insurance companies. I just do. They get in the way of me doing what I want to do for my
Right.
patient. They don't care. The only good news about sleep apnea is that it's a medical condition, it's life or death. TMD, they do not care that your patients are suffering.
Right.
So, what I would encourage, and this practice that I bought, I changed back to time.
Mm.
They used to take everybody, no matter what, through the process. And by the time they got to the doctor, they're like, wait, is this much? No, I'm out of here. Okay. We don't do that.
Mm.
We we have stages of we educate on the front end. We educate them on their insurance. We give them ranges. If somebody's like, well, wait a second, I'm gonna have money out of my pocket, that's crazy. They're not the patient for you because they're living in a
Right.
fantasy world. If they think that there's no money out of pocket, they don't understand anything. Because I'm sorry, I've never gone to a doctor for an office visit and not had, I mean, it's just not the norm,
Yep.
right?
Yep.
So, what I would encourage you, Nick, if you're going to get into this, make sure that you have systems. By the time a patient is in front of me, they've done a virtual consult with Rachel, who teaches with me, not me. That's another story if we have to get into it. I got pulled out of that because she's like, Jeff, I don't need you, right? Like you're getting in the way of this consult. And she was right. Then we bring them in for an office visit where we truly do an exam and muscle diagnostic and all that. But by the time they get there, we had the phone call, the virtual. By the time they're in front of me, we have right now just over an 80% conversion. Now, that sounds really sexy, but before COVID, we
Hmm.
were probably at, not probably, we're at about 45%.
Mm.
And then we were forced to do some virtual because of COVID. And then we got smarter because we're like, wait a second, the doctor's time is important.
Yep.
Let's make sure we get an actual person who's really, truly considering this and willing to invest in their health.
Yep.
So that was a long-winded answer, but the
Yep.
insurance thing is very difficult. It's doable, but please make sure that you're efficient with that because if you're going to have the smaller numbers, your time has to be very, very, you have to be very practical with your time.
Absolutely.
Yeah.
Okay, so bullet points for the answer. We've got the insurance-based practice does orthotics, day and nighttime splints,
Mhm.
and you're doing trigger point injections.
Mhm.
Do you do Botox in that practice?
So no, but I do Botox in my fee for service
Okay,
because
cool. What
yeah,
what happens in that practice then?
yeah. So what happens is this. So I was kind of talked into doing Botox by Rachel. She's like, and because I don't, what is it? I believe in it, but it's a Band-Aid. And,
Yep.
and I like to get to the root cause of things. But many years ago, she's like, Jeff, there's so many people are doing it. Why would we not be offering it as an alternative? And she was right. So now I offer it. We educate everybody on all our options. If somebody can't afford, say, the orthotic therapy, which is what I recommend,
Yep.
then we offer Botox. And I have many people that do it as they're saving
Hmm.
for the orthotic. Or, and this is another little tidbit for some of our our sleep docs, um, giving master injections is huge for better sleep, less clenching with our sleep appliances.
Hmm.
So I offer it. Now, the reason we don't offer it in the insurance base, they won't cover it unless somebody has, don't quote me on this, I think 15 migraines a month. And you've got to document it and this and this. And it's just, it wasn't, the juice wasn't worth the squeeze. It
Yep.
just wasn't. But I think it's an amazing thing to offer people. And, even if you have an insurance base, what I would do is offer it, but don't do it as a cash option.
Yep.
It can still be, you can still do fee for service within an insurance based practice.
Yep. Absolutely. I'll be honest, man. Hearing you, it was shocking to me that you had both an insurance-based practice and a fee-for-service-based
Yeah.
practice in TMD. And then hearing the backstory was like, okay, this makes sense.
Yeah.
So I appreciate you sharing
Yeah,
that.
no, I mean, it's not, and just so you guys know too, I can't practice in that other office.
Right.
I have associates in that office because if I did, then I'd have to bring that insurance
Yeah.
to all my practices.
Yep.
So that was a very intentional thing because here's the thing, Michael, to be very honest, the reason I did it wasn't to like monopolize the area. It's like, you know what? There are so many patients I can't help because they can't afford what I do without insurance. Some people are truly insurance dependent.
Yep.
Some are insurance driven, and when you educate them, and here's another little tidbit: do not assume they will only do what insurance covers. Do not. I'm still training this other or teaching this other team who've been there for a long time. Listen, give people options. Nikki and my fee for service base, we have Medicaid patients come to us all the time.
Hmm.
I don't accept Medicaid.
Yep.
And we also show them the difference between what a Medicaid appliance and what our appliance looks like.
Yep.
And we just give them a discount on the ProSomnus that I believe in.
Yep.
And it happens all the time. So don't get in the mindset that people will only do what insurance covers. If you educate them and give them the reasons why your product or your service is better than what your insurance can cover, many people will listen.
Yep. The
But
difference
some people
between,
need it, right? And so I
yeah.
I like the fact that I got both because I know we're helping two different populations.
Yep. And I would just, for most of our audience who is not Dr. Jeff Haddad with three practices, two of which are insurance or fee for service in the same building. That's another story for a different day.
It is.
Um,
Yes, it is.
so if you're not that person, frankly, the way that we coach our clients and talk to practices all the time, the fact that you have fee for service options, adjunct therapy, whether it's lasers and snoring, that was a different webinar we've done, TMJ, Botox, fill in the blank. These are fee for service wells of revenue for your business that offset the insurance complications.
Correct.
I mean, get your appliance, get your OSA appliance covered, and there's your nighttime portion of the splint that you're going to do for TMD.
You got
I
it.
mean, we're helping as many people as possible, but don't get bothered that the TMD side of the business is likely going to be fee for service for you. It's actually going to help you balance the scales with the insurance nonsense.
Yeah.
You know, when you don't get paid for the last couple of months of the year, you do all this work and the insurance doesn't want to pay you because they paid their 80% for the year and they want to keep their profits and they'll wait and hold your check for later. We can realize that in advance and pre-schedule more of the fee-for-service patients in those months. It helps the practice. All right, coming back to the questions, because I promised we'd do that. What kind of appliances are you using for TMD specifically without OSA?
Mhm.
And if you're addressing TMD before sleep, is there a date? What daytime and nighttime appliances do you use?
Yeah.
What labs do you work with?
Yeah, so I offer so I my main lab is Williams Dental Lab. Bob Clark. He's just an expert in this arena. He's actually he calls it the Haddad design. So if you wanted the orthotic that I use, I've designed something over the years, and he recently called me maybe a month ago. He's like, "Listen, Jeff, would you feel comfortable if I put your name on our website because everybody asks for your design? I want people to see it." I'm like, "Yeah, that's all good. I love it." Basically, it's an anatomical orthotic that goes on your lower teeth. Again, it's in a position that I find, neuromuscularly, but um, my associate in the insurance-based practice, uses the same appliance. I've taught him his own way of finding that jaw position, kind of a little hybrid. Um, but it's very tolerable because just so you know, these people are wearing this 24/7. So if somebody comes to me for TMJ, 24/7. Wait, you eat with it? Yes, you eat with it. Think about this. Here's the best analogy, you guys. People come to me, I say this to my patient all the time. You're coming to me with a broken leg. My orthotic, I know it's removable, but that's your cast. So let's say you had a removable cast in your leg and you wore it all day long, but 3 or 4 times a day, you took it off and ran down the road a few miles. Would that heal?
No.
No. You need it eating the most. Now, I know that there have been many who've been taught don't eat with it. No, there can be irreversible changes. We could get into that if we have to, but I'm telling you, I have patients, don't get me wrong, that they don't eat with it because they're terrible patients and they still get better. I have had so many patients that did not eat with it and they had no relief until they started eating with it.
Mm.
And I've been doing this for, God help me, almost 25 years. Okay. So I've
Couple
seen it all.
weeks.
Oh, yeah, it's crazy. I mean, I
Yeah.
started college when I was 10. No. So the other thing too, for people treating sleep, very similar. You've got the overlap's crazy. I've had TMJ patients that have the most perfect orthotic you've ever seen, or at least I'm verifying with objective data that the muscles are calm, no relief. They refuse to get a sleep study. We finally force them to. They get their sleep appliance. They've been suffering for 6 weeks with my orthotic. 3 days after getting their sleep appliance, they're 90% better.
Wow.
I've got so many of those in my lectures, unbelievable. So again, to encourage you, the overlap's huge.
Yep.
The other thing that I offer, Michael, is a flat version of my orthotic.
Okay.
You can't eat with it. It's still very therapeutic, but I pick and choose who gets that. If you have no pain on chewing, okay, I'll consider it.
Mm.
If you're a younger patient, 20s, 30s, okay. If you don't have really severe symptoms like vertigo, ear ringing, ear pain, um, maybe intense neck pain, it's just not meant for that, right? So
Mm.
I always use Invisalign as an example. Like Invisalign's a really cool tool, but in my opinion, it is over marketed and it's like we can fix your bite and this and this. No, it's meant for cosmetic changes and it's overused. So when somebody comes in, I look at the patient, I'm very honest with them. If they can't afford one orthotic versus the other, I'll say, well, listen, this flat version is going to give you relief, but it's going to be limited because you can't eat with it. But those are the two versions, and Bob Clark at Williams makes both of them for me. And if you
Got
say
it.
you want the Haddad design, he knows what to do.
Okay. Cool. Uh, I'm assuming yes, but I'm going to ask it anyway because somebody asked. You're taking CBCTs on your patients. Is that for TMD and sleep across the board, one or the other? How are you guys doing those?
Great question. Every TMD patient gets a CBCT, and I send out for a radiology report. I do that, and I don't have to. I do it for two reasons. One, it's very thorough. I do charge, enough for my orthotic therapy where I want them to have a value. But most importantly, it validates what they're going through and what they're paying for. Okay. I use 360 imaging. They do a great rad report. The other thing that's beautiful about it is they comment on the airway. So they know my prescription is evaluate the TMJ joints and then airway.
Yep.
And if it's less than, I think, 100 square millimeters, I think that's one of the things they look at. Patient should be recommended a sleep study because they are more prone to OSA. So
Yep.
it just gives me, again, more data to educate my patient and get them to say yes to something. I do not do it on sleep apnea patients. I know a lot of docs do. I don't, mainly because I don't need it to treat their sleep apnea. I like to know what the airway looks like, but at the end of the day, you can have the biggest or smallest airway in the world. Unless you do a sleep study, it's
Right.
just a thing, right?
Yep.
And so the unnecessary radiation, no, I've got a ton of before and afters in my lectures with before and after sleep apnea appliances. but I don't, that's not my go-to for my sleep apnea
Right.
patients. Mhm.
You can't diagnose a soft tissue nighttime disorder with a daytime hard tissue scan.
That's correct.
Yeah.
That's
Cool.
correct.
All right. Any comment on tap appliances?
So my thing, this is just my philosophy. I don't, and again, it's a TMD thing, right? I'm sorry. I don't like appliances that are attached. I don't like the mandible and the maxilla attached. I'm not saying that it's not very, very effective, but I have found that that restriction can cause some unnecessary issues for me. So I have always used I was a Soundadent person forever, and now I'm a ProSomnus Evo. I just like them to have the freedom. So for me, a tap appliance, even a Herbst, for me, I just don't love them. But just so you know, back to the insurance-based one, okay? My associates do 90% Herbst.
Yep.
I think a Herbst is just better than a tap in my opinion. It's just more comfortable. I've tried them all. My partner and I went through years trying all these crazy, I mean, the Oasis, I mean, just things that are so scary, but we wanted to know. And I just, my big thing in my practice, I put things in people's mouths that I'll put in mine and my family members.
Yep.
I have mild sleep apnea. I wear a Evo. I love it.
Yep.
The crowns I have, I'm not putting a PFM crown in somebody, okay? They're going to be all porcelain Emax that my lab makes. So it's just my philosophy. I like, if I've tested something and I believe in it, then I can, very easily educate and tell my patient, yes, this is what I would make for myself or my family.
Yep.
Yeah, that makes
Awesome. All right. So I knew this was going to happen
Running out of
before.
time?
Oh yeah, before we started tonight, I'm like, oh,
sense.
we have 3 minutes until it's 9 o'clock your time, and we still have to do our lightning round questions. I want
Yep.
to do a quick plug for Dr. Haddad here and what we're doing in September.
Mhm.
If you guys have not been on social media, you haven't heard us talk about this, email about it, etc., you've been under a rock. We still love you. We would love to see you in person in San Diego. It's a beautiful place. Dr. Haddad is going to be sharing what he and Rachel's protocol is for this whole virtual consult. If he's got the psychology background and he knows how to sell, but she does it better with higher conversion, he's going to dive into that specific topic for us. We've also got a host of other lecturers that are awesome. Beyond that, like, come hang out, eat great food, see the beach. Like, I know some places don't have sun right now, whether it's from smoke or winter.
Right.
Um, I don't know if it's winter. That was a misspeak. If it's winter in July, you're in the wrong place. I was just up in northern Canada. The sun didn't set like for a week and a half while we were there. It was crazy. Um, anyway, we'd love to see you in San Diego. It's in September 18th, 19th. If you want to come, use Dr. Haddad's personal code. It'll get you $250 off your ticket. That's on the screen. If my screen works, there we go. You can use your phone to get this as well. Use the QR code. One other thing, we're a coaching company. Most of you guys know that. If you don't, this is what we do. It's how we make a living. We also give away free coaching calls to anybody who wants a quick conversation, evaluate where you're at, see what's the next step. We're happy to give you some time. Also, don't forget your CE because it is 5:59, so we're a minute early. We still have a couple of questions for Dr. Haddad,
Yeah.
but
Yeah,
uh,
good.
we'll put that in the chat as well. Team, if you guys can put the link in there for the CE, I'd appreciate it. Yeah, we'd love to see it masterclass. And Dr. Haddad, I'm going to go back to that one. All right, here's your lightning round.
Okay.
I'm going to ask you to answer these in 30-second answers
Got it.
maximum.
Got
Okay.
it.
What is the
Lightning
craziest
speed.
lightning speed? Let's pretend we're in a consult and you're going to get in and out of,
Time is money.
All
Love
right.
it.
What is the craziest thing you've done in the last 10 years?
I I've been helicopter skiing, and it was supposed to be once in a lifetime. I told my wife, and I've done it 4 times in the last 15 years. And I told her every time I'm asked, I'm doing it again.
Oh, that's awesome.
Yeah,
So if I ride in the helicopter and watch you jump out of it, does that count?
it does. I mean, you'll love it. You're gonna
Okay.
want to get out though, but it's pretty
Oh my
amazing.
gosh, that's crazy.
All right. If you were to go back in time and give yourself one piece of advice doing your very first day of DSM and TMD, what would that be?
Listen to the patients, and I'm not a very good listener because I'm always waiting to talk. Okay, and I'm not joking. Listen to your patients. Don't tell them what you want to do to them or for them. Listen to what they want and are willing to do. Because too many dentists, they got some crooked teeth or this, and they got an airway issue. Like, well, listen, we should get you in braces and this and this. And you're talking to a 60-year-old and they don't want that.
Mhm.
Do what they're willing to do. Okay. Because for me, I want to make people, I want to impact people's lives. But I can't do that if I'm just putting what I want to do there. I need to know what they're willing to do. So listen to your patients.
Cool. What's one piece of equipment in your practice that you absolutely could not live without?
The dental tens. I'm relaxing
Okay.
muscles every single day, whether I'm doing a full mouth reconstruction, whether I'm doing a sleep appliance, or whether I'm doing a TMJ orthotic. I won't do that without finding a calm muscular position and prove that position to either make an appliance or rebuild their bite.
So we outstanding. We just had an attendee say, so you do not tell them that you want to choke them. No.
No, no,
We don't want to
I
do
would
that.
not recommend that.
Oh man. All right.
Right?
What is one meal that you could eat every day for the next month?
Ooh, I'm a sushi guy. My daughter's a sushi girl too. We went yesterday, got sushi, went and saw the Odyssey, and had a great time. So yeah, I could do the sushi thing pretty much anytime.
Sounds good.
Yeah.
All
Awesome.
right, last one. Who has been an influential coach or mentor in your journey so far?
Oh my goodness. God, I have so many. I would say, wow, this is so bad. I don't want to like leave anybody out. To be honest, Brad Durham, he's retired now. He was down in Savannah, and I would actually like this story because I was on his boat. We were down there for a consulting thing, and he said, "Jeff, why are you still doing fillings?" And I said, "Because I'm a dentist. What are you talking about?" You know? He's like, "Jeff, that's like a cardiovascular surgeon handing out blood pressure medicine. With your skill set, you should be treating more TMD, more sleep, rebuilding faces, all this stuff. Get associates to do that. If you don't, refer it out." So this is what I would leave with the crew here. Most people say they want to treat TMD and sleep, but they're too busy to do it.
Mm.
You can't be a jack of all trades and a master of none. That conversation happened 12 years ago. Now, don't get me wrong, I've done a couple fillings here and there because I had to, but I gave that
Sure.
up so I can do this other, in my opinion, more impactful, dentistry. So you have to give up some things if you want to do what you love.
Amen.
Absolutely. And that's what we try to coach on,
Yeah,
definitely, is how to find that time that to make your passion and still have money rolling in on the bread and butter side.
absolutely. It's all possible, but you have to make time for things because not only will you not get good at it if you don't do more of it, but when patients call and they need you and you're booked out for 6 weeks, you've lost them.
Yeah.
So we'll talk about that at my lecture at your
Yeah.
at the pivot thing because
Yep.
I talk about how you plan for success, how just with scheduling and all that stuff. So little tidbit, a little teaser for all of you who are coming.
I'm
Yeah.
excited. I can't wait to learn.
Good.
That's awesome.
And you guys, I realized just now that the chat, the CE link went to the host and the panelists. That is not helpful because everybody else here is the one who wants the CEs. Um,
Uh,
we will email that. I don't know, that's a technical difficulty right now. We apologize for the chat malfunction. We will email the CE link. You can use the QR code on the screen. It does work, but we'll email you the CE link as well as the registration for the next webinar. We have our next one coming up on Wednesday,
August 12th.
August 12th. Thank you, Joe. I was gonna guess.
See, you see what a team does for you guys? Listen,
Team,
these are
Yes.
your
team.
teammates.
Team. Thank you,
Team.
team. Hey, Jeff, seriously, we appreciate you being here, being this energetic this late at night, your time. And I mean, honestly, man, just opening up and being very real about the changes, the details, the successes that you've had and sharing that with us. Thank you for your
Yeah,
time
thank
tonight.
you.
We
That was great.
appreciate you.
I appreciate you guys having me. I love it,
Yeah.
and I know I'm a little long-winded here. I'm just very passionate about what I do.
Yeah.
But no, I'll join you guys anytime you want to have me.
Love it, man.
Perfect.
Thank
Love
you
you
so
too.
much.
Thanks,
Thank
guys.
you.
Have
Take care. Have
have
a
a good
great
night, you
night,
guys.
everybody.
Bye.
Thanks.
Bye bye.